before the tremors and bradykinesia or slowness of the movement starts. So if you have got this symptom, please express it to the doctors. You may not be knowing that it is a part of the early part of the Parkinson disease. It may be very important for your doctor to tell about it. Second thing is excessive sleepiness. You feel the guy sits a bit quiet, he goes into sleepiness. This is a part of Parkinson's disease by itself, but it may precede the onset of Parkinson's disease. Please express it to your doctor that I am having like this. Is there anything like that? Or your relative having like this, is anywhere related to Parkinson's? Be open-minded and discuss these problems with your consultants. That's one. Loss of taste, loss of smell. These are all precursors of Parkinson's disease. They are not specific to Parkinson's disease, all right. They can also occur in some diseases like Alzheimer's disease, but be clear and discuss with them. So these are the main symptoms, what we call as motor symptoms and non-motor symptoms. Sometimes constipation, urinary discontrol. These are the things which you shy away from telling the doctor. So that is part of the symptomatology of Parkinson's disease. So please be aware of it and discuss with them, because they have some different treatment, different assessment than what you have for motor symptoms of Parkinson's disease. Now, diagnosis of Parkinson's disease by the doctor, most often when I examine them, some people, very early stage of Parkinson's disease, may not be diagnosed elsewhere. When I say he would have already gone to some orthopedician saying that I got difficulty moving because my knees are stiff and so on and so forth. When I tell them I got Parkinson's disease, now they don't believe it sometimes. Sometimes they feel that I diagnosed it very well. There is a separate treatment for this. The moment you give the treatment, maybe you call him after 10 days or 15 days for initial evaluation, even one tablet. The next time he visits, the first dialogue he says, "Sir, ನೀವು ದೇವರು ಸರ್ ನೀವು ಮನುಷ್ಯ ರೂಪದಲ್ಲಿ ಬಂದಿರಿ ನೀವು ಅಷ್ಟೇ ದೇವರು ಬಿಕಾಸ್ ಇದನ್ನು ಯಾರೂ ಕಂಡುಹಿಡ್ದಲ್ಲ ನೀವು ಕಂಡುಹಿಡ್ಬಿಟ್ರಿ ಅಂತೇಳಿ." So that is the difficulty in diagnosing Parkinson's disease in very early stages. Later stages, various complications, it becomes much easy. Understand? That's one. Then sometimes patients carry a feeling, or it's because of the present day activities, you don't do much of investigations when you diagnose Parkinson's disease. I examine a patient, tell him you got Parkinson, give him tablets, he improves, still he is not happy. ಏನು ಸರ್ ಎಮ್ ಆರ್ ಐ ಮಾಡಲಿಲ್ಲ, ಸ್ಕ್ಯಾನ್ ಮಾಡಲಿಲ್ಲ, ಏನಿಲ್ಲ, ಡಯಾಗ್ನೋಸ್ ಮಾಡಿಬಿಟ್ರಲ್ಲ, ಇಲ್ಲಪ್ಪ ಅದು ನಾರ್ಮಲ್ ಬರ್ತಿದೆ ಪಾರ್ಕಿನ್ಸನ್ ಇಲ್ಲ ಅಂತ ಹೇಳಿದರೆ ಆಯ್ತು ಸರ್ ಮಾಡಿಸ್ಬಿಡ್ರಿ ಸರ್, ಟೀಕ್ ಐ ವಿಲ್ ಗೆಟ್ ಇಟ್ ಡನ್ ಅಂತೇಳಿ. ಯು ಗೆಟ್ ಇಟ್ ಡನ್, ಇಟ್ ಕಮ್ಸ್ ನಾರ್ಮಲ್. ನ ಸೆಕೆಂಡ್ ಕ್ವೆಶನ್, ಸರ್ ಎಲ್ಲ ನಾರ್ಮಲ್ ಮತ್ತಿದೆ ಯಾಕೆ ಆಗ್ತದೆ? ಸೊ ಪಾರ್ಕಿನ್ಸನ್ ಡಿಸೀಸ್, ಯು ಡೋಂಟ್ see it on scans. So don't harp on your doctors to get a MRI done or something like that. Of course, there is a role for scanning and so on to rule out other conditions which may mimic Parkinson's disease. The treatment may change off. So from that angle, the doctor will decide whether to have investigations or not on theory. So that is part of the diagnostic problem. Now, when it comes to treatment part of it, basically you must be aware that Parkinson's disease is a condition where in the small part of the brain, there are certain cells which produce continuously a chemical called as dopamine. Now, for unknown reasons, these cells become degenerate, dead gradually. They can't produce dopamine. So the body becomes stiff and various other symptoms, what you have already knowing. When we treat now, or when we started using levodopa for the last about 50 years or so, after Honigquist's discoveries, we are just doing replacement therapy. You must know that that chemical is not produced by the brain, and we are replacing from the outside, and it does and gives you good symptomatic relief. It is a pure replacement therapy. There is no cure as such for Parkinson's even today. There are a lot of work going on elsewhere, all right. Why I express this is, patient is happy that I diagnosed Parkinson's disease. Somebody could not do it. I gave him some treatment. He's very happy. Maybe then I say, okay, you continue this treatment, come to me after a month. Second time, he's not really that happy. ಏನು ಸರ್ ಗುಳಿಗೆ ತಗೊಂಡಾಗ ಮಾತ್ರ ಇದು ಹೋಗ್ತದೆ, ಗುಳಿಗೆ ಬಿಟ್ಟರೆ ಮತ್ತೆ ವಾಪಸ್ ಬರ್ತದೆ. ಸೊ ಬೇರೆ ಯಾವುದಾದ್ರು ಬೆಸ್ಟ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಇದ್ದರೆ ಹೇಳ್ರಿ, ನಾನು ಫಾಲೋ ಮಾಡ್ತೀನಿ. ಎಷ್ಟೇ ಕಾಸ್ಟ್ಲಿ ಆಗಲಿ ನಾನು ಫಾಲೋ ಮಾಡ್ತೀನಿ. ದಿಸ್ ಈಸ್ ಅ ಥಿಂಗ್. ಯು ಮಸ್ಟ್ ನೋ ದಟ್ ದಿಸ್ ಈಸ್ ಅ ರಿಪ್ಲೇಸ್ಮೆಂಟ್ ಥೆರಪಿ. ಯು ಹ್ಯಾವ್ ಟು ಬಿ ವೆರಿ ರೆಗ್ಯುಲರ್. What happens is, most often, these patients have blood pressure, diabetes, and so on, thyroid, especially ladies. When I ask, what all you have got all this? Okay, you are taking Parkinson's disease drugs also. So when the patient worsens, I'll ask him, why have you missed the tablets? ಇಲ್ಲ ಸರ್, ಏನು ಬಿಟ್ಟಿಲ್ಲ. ಮತ್ತು 4 ದಿವಸ ಆದಮೇಲೆ ಇವಾಗ ವರ್ಸ್ನಿಂಗ್ ಆಗಿದೆ ಅಲ್ಲ, ನೀವು ಬಿಟ್ಟರೆ ಆಗ್ತದೆ ರೀ ಅಂತ ಹೇಳಿದ್ರೆ, ನೀವು ಇಲ್ಲ ಸರ್, ನೀವು ಊರಲ್ಲಿದ್ದಿಲ್ಲ, ನಾನೇನು ಮಾಡಲಿ, ನಾನು ತೊಗೊಂಡಿಲ್ಲ ಟ್ಯಾಬ್ಲೆಟ್ಸ್. ಇಫ್ ಆಸ್ಕ್ ಹಿಮ್ ಬ್ಲಡ್ ಪ್ರೆಷರ್, ಶುಗರ್, ಥೈರಾಯ್ಡ್, ಅದನ್ನ ಹೇಗೆ ಮಾಡ್ತಾರೆ? ಅಯ್ಯೋ ಅದನ್ನು ನಾನು ಬಿಡೋಲ್ಲ ಸರ್, ನಾನು ತೊಗೋತೀನಿ ಅಂತ. ಸೊ ವಿ ಆರ್ ನ್ಯೂರಾಲಜಿಸ್ಟ್ ನಾಟ್ ಇಂಪ್ರೆಸಿಂಗ್ ದ ಪೇಷಂಟ್ ದ್ಯಾಟ್ ಇಟ್ ಇಸ್ ಅ ರಿಪ್ಲೇಸ್ಮೆಂಟ್ ಥೆರಪಿ ಆ್ಯಂಡ್ ಯು ಹ್ಯಾವ್ ಟು ಟೇಕ್ ಇಟ್ ವೆರಿ ರೆಗ್ಯುಲರ್ಲಿ. The moment you leave it, your disease will worsen. This happens with blood pressure, diabetes also. But you can't see the effect. In case of Parkinson's disease, you miss 2 tablets, you start becoming stiff. You complain to the doctor. If you miss a tablet of diabetes, your sugar will jump up. But you can't see it unless you get it tested. So you don't complain about it. But still, the attitude of the patients is that BP, sugar, thyroid should be respected more compared to drugs of Parkinson's disease. This has to vanish. And I think it is a job of our doctors only to impress that what we are doing is a replacement therapy. This is the same problem with BP also, sugar also, thyroid also. So everywhere it is replacement therapy. There is no cure for none of, or any of these disorders. Second is following the instruction given by the doctor. We tell you take it 4 times a day and come and see me after 15 days. I mean, when he worsens later on, you ask him, have you taken the tablet? Yes sir, what to be teller? Have you taken 4 times? ಇಲ್ಲ ಸರ್, ಅದರ ಗುಳಿಗೆ 16 ಗುಳಿಗೆ ಆಗ್ತಾವ್ರಿ, ನಿಮ್ಮದು ಒಂದು 20 ಗುಳಿಗೆ ಆಗ್ತದೆ, ನಾನು ಏನು ಮಾಡಲಿ? ಅದಕ್ಕೆ ಪಾರ್ಕಿನ್ಸನ್ ಬಿಟ್ಟಿದ್ದೀನಿ ಸದ್ಯಕ್ಕೆ 2-3 ದಿವಸ. ಅಥವಾ ಇನ್ಸ್ಟೆಡ್ ಆಫ್ 4 he'll take twice. So this has to be very clear. This is the behavior of a person who has got more tablets but can't avoid it because everything is replacement therapy. You have to impress upon them that this is necessary to take the dosage as per the schedule. Also, if the doctor has said that take it before meals, after meals, the effect changes. If you take a tablet and you leave it up after meals, it may be slow, long acting. If you take it before meals, it may be fast and short acting. So this has to be explained, educated by the doctor to the patient. This is very important. And also make a point that you always carry a list of the drugs you are taking, the Parkinson patient. Whenever, so for example, you want to change a consultant, if he asks you, or the same consultant, he goes, ಏನೇನು ಟ್ಯಾಬ್ಲೆಟ್ ತಗೋತಾರೆ ಹೇಳ್ರಿ ಅಂದ್ರೆ, ಮನೇಲಿ ಬಿಟ್ಟು ಬಂದೀನಿ ಸರ್, ನೀವು ಹಳದಿ ಗುಳಿಗೆ 2 ತೊಗೋತಾ ಇದ್ದೀನಿ, ಬಿಡಿಯೋದು 4 ತೊಗೋತಾ ಇದ್ದೀನಿ, ಮತ್ತೊಂದು ಸದ್ಯಕ್ಕೆ ಬಿಟ್ಟಿದ್ದೀನಿ. You don't know what it is going on. And Parkinson's disease is very dangerous as far as that is concerned. You have to be very clear what you are taking. So always keep a chit in your pocket whenever you go to the doctor saying that this is my medicines. Last is, make a point to spend time with the doctor. Doctors are always busy, but you request them to give more time, discuss the side effects of these medicines. Everything on this earth has got side effects. It's a dictum. Anything which has got side effect has got an effect, basically. Somebody says, idಕ್ಕೆ side effect illa, ಇದು ತಗೊಳ್ರಿ, means he is giving wrong information. Anything on this earth, if there is no side effect, there is no effect as well. It's a bland stuff. So don't go on the information by some people who say, side effect illappa, ಅದು ಬೇಡ, ಇದು ತಗೊಳ್ರಿ. No, don't disturb yourself. So these are all some hardcore points, what you should do. No, as far as a Parkinson patient. Second is common questions in practice is nutrition. Sorry, ಏನಾದರೂ ಪಥ್ಯ ಇದ್ರೆ ಹೇಳ್ರಿ. ಏನೇನೋ ಪಥ್ಯ ಇಲ್ಲ. Parkinson's disease, you can have plenty of average vegetable, fruits, and so on, plenty of water, so that problems of constipation and so on will get clear. Only suggestion is that if you are taking a lot of proteinous food, and which is a natural phenomenon, keep them in the evening times, because proteinous foods combat or contradict with medicines which we give. Say levodopa, the effect can be reduced by taking a cup of milk. So avoid taking milk or proteinous food in the morning times when you are active and so on, and keep it in the evening time. This is how it is. Third is, as Dr. Srivas just now said, this is one disease where you have to be more physically active. Make a mental workup saying that I have to move, I have to walk. You may require somebody's help. Nothing wrong. Move, and you will continue to move. If you say, I got Parkinson's, I want to take a rest, sorry, it's the reverse. Similarly, mental makeup. At that age where Parkinson is common, in our Indian society, it's a feeling that ನನ್ನ ಮಕ್ಕಳ ಮೇಲೆ ನಾನು ಭಾರ ಆಗಬಾರ್ದು, ಸೊಸೆ ಮೇಲೆ ಭಾರ ಆಗಬಾರ್ದು, ಅವ್ರ ಮೇಲೆ ಭಾರ ಆಗಬಾರ್ದು. So that sometimes gives rise to depression. Again, if you go with that symptom to some other doctor, he will put you on antidepressants, which is one more tablet coming up there. So you have to develop a mentality saying that, well, there are so many things. Yesterday I was seeing WhatsApp, a lady driving a plane with her feet who doesn't have arms. Fine, it's a determination that is required. And then physical exercise said, mental exercises, mental relaxation, and so on. These are the main things which I practice, I come across in my practice in Parkinson's disease. Now, Dr. Prashant was saying, tell something about work done in Parkinson's disease from Karnataka. Now, we must accept the contribution of medical scientists. India as a whole is on the lower side as far as Parkinson's disease is concerned. There have been studies in epidemiology, I should say, some amount of recent studies on genetics, and to that extent, Karnataka is good. There are a lot of epidemiological studies started almost 50 years ago in Bangalore to find out the epidemiology of Parkinson's disease and related disorders. And recently, there is a lot of work going on in genetics from Bangalore itself. And similar work has been started recently in Dharwad, Belgaum area also. That's what we call North Karnataka. So that is a significant contribution, mainly in epidemiology and genetics. Even 2016, I read a paper, a review paper on Parkinson's disease epidemiology from NIMANS. There's a lot of things. Before that, and last thing I should say, we should remember Dr. Bala Manyam. He is a MD medicine guy. He took a lot of interest in ancient Indian medicine, lot of interest in Ayurvedic medicine. He was the one, and he worked in Illinois, America, most of his life. Unfortunately, he died last year. And he was the one who took a lot of interest in ancient Indian medicine and described that various Ayurvedic terminologies like Vata Prakriti produces neurological disorders, psychological disorders, and all. He described it. Then he also showed how Parkinson's disease was described by our own people about thousands of years ago, called it Kampavata. Then he also showed that what levodopa has been put today in the map of treatment of Parkinson's disease was available in the form of seeds, Mucuna pruriens. It is also called Atmagupta. That's what I read his paper only about a week ago. And you must remember, this is how he has produced it. Then he saw that Mucuna pruriens could be taken, make a powder, and then used for Parkinson's disease. Why I stress this is, this Balamanyam, who worked and died in Illinois, comes from Bangalore. He is a person who was trained from Bangalore Medical College, and we feel proud that such a contribution has been done from Karnataka. Thank you so much.
Thank you. Thanks a lot. Want to ask someone to ask questions also, sir, on this? Anyone want to ask anything on this? Usually for a...
No personalized also. Broad things if you want, yes.
Can you come a little bit forward so we can't see you from there because of bright lights?
Hi. Hi, my name is Hardik, and my father here is a Parkinson's patient, and we get treated under Dr. Muthane, who is also here. So I have a question. In fact, I have two, but I'll start with one. So the question is, you mentioned, sir, that it's very important that Parkinson's patients have a very active physical life.
Yeah.
But what happens in some of the cases, like the case for my father, is that he has blood pressure variation. Okay, so he has this blood pressure falls. So now the question is, and it's very difficult to predict. So how do you maintain a balance between having sufficient physical activity and making sure that he doesn't fall, because it's unpredictable? How do we know that, right? So
Yeah. See, as far as these things are concerned, they go hand in hand. Say, fall of blood pressure may be a part of the Parkinson autonomic neuropathy. Dr. Muthane has been working on it for several years. And this question, because you're not certain when he is going to develop hypotension, fall, and so on and so forth. One thing is that medicines should be prescribed if necessary for these symptoms. Say autonomic neuropathy, if it occurs, Dr. Muthane himself will tell these are the medicines to take and these are the medicines to avoid. That's one part of the story. Second part is your body will tell how much to go, how much not to go. There's nothing like you do 15 minutes of exercise for Parkinson's disease, 2 hours exercise Parkinson's disease. In such case, as especially to your father, I would say his body will tell. Say, for example, you are trying to he'll say, he will fall down. So he is giving a signal that I am going to develop syncope. My blood pressure is falling. There's an indirect language there. You have to follow these things and see that he does some exercise as much as possible by him physically. Don't force him beyond a point where he develops some new symptoms. Not that he should keep idle and no exercise, take rest and so on. It's a balance which the body tells you. I think we should accept that.
thank you, sir. Can I ask one more?
Yeah, please.
Okay. You also talked about, towards the end of your address, about Ayurveda and all that.
Yeah.
Now, what happens is, we come from a family where we all have scientific temper. My sister is a doctor, I am an engineer. So we typically tend to believe allopathy and all that, right? But what happens in this particular case, since Parkinson's doesn't have a root cause and it's, all of that is symptomatic, right? Because of family pressures and people from other, it's very easy to get tempted when they suggest Ayurveda or homeopathy, right? And as you said about side effects, right? The common thing is, hey, it doesn't have side effects. Why do you bother? You can continue your allopathy. And we find it we know Dr. Muthane is one of the best. We are convinced, but the family pressures are so high, saying, hey, anyway, it's degenerative. It's only going to get worse. Why don't you try out something else? Now, we don't know, right? We all have scientific tempers. We are engineers and doctors, but people tend to suggest and then say, well, there is nothing to lose, right?
Yeah,
So how do you balance that and
No,
do you
see,
really go for it?
Very true. Whenever there's no cure, it's a human nature, human mind to go somewhere else for better treatment, thinking that there may be a cure, may be a better treatment and all. This is all, after all, a human nature. When my father had malignancy of the liver, I was already MD, practicing doctor and so on and so forth. I took my father as a MD doctor to that Kashayapana, because here it is not a question of just giving physical solutions. A stage comes when you say it is not curable, a mental